Hi, I'm Chris Hufnagel with InControl Medical. I am the territory manager representing the InTone product for take-home pelvic floor therapy for women that suffer with stress, urge, and mixed incontinence. So, this is the InTone device. It's a personal trainer for your pelvic floor. It's a very unique design in the fact that this is actually a balloon. So when the device is inserted, it's pumped up to the comfortably snug level for each woman. Once they turn the device on, it actually coaches them through a 12-minute program, and right now it'll actually tell you to put gel on, insert the device, and pump it up. So once this has been inserted to the base of the balloon, all the woman does is hit the start key, and it takes a resting baseline pressure. Okay, so essentially what will happen is we're doing active biofeedback. And the biofeedback is a visual biofeedback. So when the female contracts her pelvic floor, she has active biofeedback that she can see the squeeze, the strength or the weakness of her squeeze. And it counts down. It does a 3-second short squeeze, relaxation for 10 seconds, and then another 3-second short squeeze followed by 10 seconds of relaxation. So it does 3 short squeezes, 1 long squeeze, 3 short squeezes, 1 long squeeze. At the end of the 2 minutes of active biofeedback, it starts a 5-minute electrical stimulation session. The stimulation does 2 things. For any patient that has overactive bladder, it delivers a very low-level stimulation to calm the bladder over time. It then modulates up to a quick high hertz, and in doing that, it elicits an involuntary contraction of the pelvic floor muscles. So for any patient that cannot identify the appropriate muscles that she is actively trying to contract, the stimulation will help her brain to identify those muscles, and it will actively contract those muscles for her, thus strengthening those muscles for her over time. So it's 2 minutes of volitional exercises, 5 minutes of involuntary relaxation while the stim does the work, and then a subsequent 5 minutes of volitional exercises again. At the end, the program automatically shuts off. The patient deflates the device by pressing the black button here. They unplug this, take it out, go over to the sink, pump it up so that the grooves are exposed, and then cleaning is very simple. It's just simple soap and water on this portion here. They rinse it off, dry it off, deflate it, and then stick it in their nightstand or underneath the bed, and they can use it again the next day. So the protocol for patients that have stress incontinence is they use the InTone once a day for 12 minutes in the privacy of their own home for 90 days. The patient has to come back in for regularly scheduled checkups with the office, because when they come in at 2 weeks, 6 weeks, and 10 weeks, their pelvic floor gets used to the sensation of the electrical stimulation. And in order to make sure that the patient progresses and does not plateau, each time they come in, you will plug this into the computer, you will see that they've utilized the InTone, and then you will increase their stimulation level until it's comfortable for them. Again, 2 weeks, 6 weeks, 10 weeks. Typically at the 10-week mark, the patient with stress incontinence is approximately 80 to 100% better. So they'll come back in sometime after the 12 weeks, and at that point they'll be dry. Then they will go into a maintenance program. Once they've completed their 90-day protocol, they will then just utilize the InTone for maintenance of their pelvic floor. So once or twice a week they'll utilize InTone, and that will keep their stress incontinence symptoms at bay. If they have urge or mixed incontinence, they'll use the InTone for 180 days, and at the point of completing their 180 days, they will then just use the InTone once or twice a week for maintenance to keep their overactive bladder symptoms in check. All right. So we know that there's a lot of different continence therapies out there for patients, and it spans the gamut from very conservative approaches all the way to a more aggressive approach such as surgery. When you're comparing the cost of InTone for your patients to these other options such as an anticholinergic, which is obviously a medication that they will take for the rest of their life. On average, patients pay anywhere from $40 to $140 a month for that medication out of pocket, even with insurance coverage. With regards to surgery, patients oftentimes pay a $3,000 or $4,000 or $5,000 deductible to have that surgery, and there's no guarantee that the surgery is going to work, and there's oftentimes can be some adverse side effects as well. There's other options as well, such as Botox or Interstim or even PTNS, and all of those are for treatment of overactive bladder, and each of them has a cost associated that would be greater than what InTone would cost the patient. InTone, as a new therapy, is a great product that can be used in conjunction with some of these existing therapies, or if some of those therapies have not been as efficacious as needed or worked as well as the patient wants, InTone can be used in place of them. When that relates to the overall cost for the patient and how that relates to the overall cost is that with InTone costing $595 and having a few office visits in conjunction with that, the patient is spending under $1,000 total to get themselves dry. Okay. So InTone is actually covered by Medicare, and here locally in Connecticut is also covered by Husky, which is Medicaid in Connecticut. A number of private insurance companies are covering InTone, and hopefully more will cover in the future. If the device is not covered, it costs $595, and your patient can have a flexible payment plan option of either 3 months or 6 months to pay for it over time to lessen that $595 burden. On top of that, InControl Medical will provide the patient with a 100% money-back guarantee. So if at the end of the 90 days or at the end of the 180 days, they are not satisfied and they've utilized the device, InControl will refund them their full $595. So with regards to InTone and considering this for your patients as a conservative treatment for their stress mixed or urge incontinence, it's a very cost-effective proposition. It's $595 for the patient if it's not covered by their insurance company, and it comes with a money-back guarantee. I know of no other continence therapy that actually provides a 100% money-back guarantee. Also, in conjunction with that, there's another side to the coin. You want to consider, what will this do for your practice? As a new revenue stream, you'll generate somewhere between $500 and $1,000 per InTone patient because they have to come back in for regularly scheduled office visits. Secondarily, your patients will be happy and dry, and they will then go and tell their friends about this wonderful new technology, and they will come to you to get the InTone. So you'll get some referral business from it. We can go out and advertise within your local community to try and bring patients to your office, and you will actually see national television advertising for InTone in the very near future. So we can list you on our website as the local InTone specialist so that when patients become aware of this technology, they can come to your office and get set up with it. If you'd like InTone for your practice, please contact SurgeryPRO, our local DME partner. You can visit them at www.surgerypro.com, or you can contact me directly at 978-660-9420. Crap. But the first part of that was good.
Yeah, that was fun.
Okay.
Although there were a couple of loves in there.
Love? Oh, God. Good lovey-dovey. This is Barry White. Welcome to the InTone Hour.
Oh, God.
For 90 minutes. With regards...
12 minutes.
God. Coffee. My brain is going to mush. It's been a long day.
Uh-huh.
You ready to go to the mattresses? Is that what you're saying? I don't think that's going to be in the outtake, Marcus.